So whereas you see that in countries which have progressed in the world, the social security nets, the basic health service delivery, the basic education delivery, all these are catered for by the state. In our case, as we have created more and more wealth, we have not been able to allocate a decent portion of that wealth to the basic service deliveries. The result is that the poor are getting poorer and the rich are getting richer. And that is at the expense of state policy, not anything else. And that is what we call in the modern parlance today, the elite capture. Now, this elite capture again is also reflective of why our health policy or our public policy narrative in general is totally focused on issues that are not the issues of majority. They are the issues of a very small minority. So if you see, every day the news flash across the screens would be that one chief minister or the other, or one governor or the other went to a hospital or a facility, and all that he looks at is that what is the kind of machinery and equipment available there? What is the kind of tiles which are installed there? Nobody has gone and asked that how many radiologists you have, how many gynecologists you have, how many psychologists you have. Is there anybody who is treating mental health issue? Believe me, in the entire province of Punjab, there is one Punjab Institute of Mental Health, PIMH as we call it, right? It is located right next to the Punjab Institute of Cardiology. Punjab Institute of Mental Health was there when we started to build the Punjab Institute of Cardiology. It is an older institution. But if you look at the two, you will understand that where the focus of public policy and public money in health sector is. Khalsa, you have done very well to bring the social health into focus. Believe me, most of the public policy practitioners on this subject, they are not even aware of the social health as a core part of the health issue. They are not. They don't even, they will only start making or framing policy on it when they will recognize it as an issue. Most of them have never heard about it as an issue. So, I do not want to be, take a very long time, but we are now increasingly seeing 2-3 things. And those are, again, related to the different segments of society, which again underline the increasing difference between the haves and have-nots. I think it was Dr. Salma who spoke about the, lines of children begging on the traffic signals and young mothers, trying to get something to give their children milk or food. But I wonder if we have also noticed the growing anger in the eyes of the people standing on those traffic signals and trying to beg a penny or two. Or have we seen the increasing display of anger if by chance, you step into another lane of traffic, not because you are driving recklessly, but because, for some reason, the way, people 70 years of age who are driving 65 years of age with, looking very educated and others, the way, they try to whiz past you and the anger with which they look at you, that does not really indicate that they are in a hurry to reach somewhere. That indicates that there is a built-up anger in them. Of course, you can't identify what are the reasons when you look at their face, but you can see that there is a built-up anger in them, which is either related to the way they are living their life or related to the way they are, facing neglect at their home, maybe by their children who have grown up and become very, progressive, and, or by the society and the family at large. And related to this is the increasing requirement in all the major cities for old people home, something which was alien to our society. I was just told a few weeks back that the number of old people homes in Lahore is multiplying because no children want to, keep their aging parents with them. Nobody wants to look after them. Now, that is, to me, it is not really an indication of, something lacking in a child or his wife, because normally in our case, the parents normally put the daughter-in-law into focus, that it is because of her that we have gotten out. I have seen a number of cases in which this is absolutely irrelevant. This is not even, something which a daughter-in-law has demanded. This is purely, a decision of the son who wants to have a life of his own style at home, and more old age homes are coming up, and we are seeing, increasing issues of behavior, which of course are a growing sign of the social health issues at all levels. I'm sure we have all heard, the family and other levels, but let me focus on the workplace, because, for 40 years, we have gone through, working in different levels and offices. And at times, one was forced to say that a few people, and a good number of them, if they did not have the title of an official position behind their back, their behavior to their subordinates, to their colleagues, and particularly to the opposite gender colleagues, was such that they would not be in an office, but will be sent to a mental health facility. We have seen this. And again, let me tell you, in spite of so much talk about it, it is on the rise. It is not on the decline. Why? Because, we have created offices, very powerful offices. We have, the ombudsperson for the workplace harassment. We have ombudsperson for the women harassment. We have created all kinds of offices. But those offices are just to, satisfy our conscience, or may meet a public policy requirement for acquiring a loan somewhere from the IMF or an international convention that we have signed. There is no heart and soul behind it. There is no recognition behind it that we actually are suffering from this malaise, from this disease, and there is a need for us to create an institutional framework as to how to deal with it. So let me conclude by saying that this is a massive issue. This is a massive issue, and the bigger the issue is, the smallest is the start that is always made to get to it. So I must appreciate Hamad for bringing all of us together. I have just two things that I would like to end with, and that is that we can make a start by preparing a policy paper on the social health, which we can take to, number one, the Prime Minister and also the 4 chief ministers. Because in our system, the policy only starts to notice if it is brought top down. The other way is too long and too difficult. Maybe that may not be even possible. But if we can frame a policy paper with some data and some analysis, and, with the kind of experts, the subject experts that Hamad has been able to gather today with their views, I think that policy framework can be brought into at least the, next statement, the health policy statement that is made, and one can make any possible effort to get that done. So that is my first suggestion. And the second suggestion is that we really need to redefine the concept of social security and poverty alleviation, with more focus on social health than just meeting the day-to-day, what you call food requirements. So if we can, one way is that we also include that in this policy paper that I'm talking about. And the second thing is that we take it up as a separate subject, because, more and more in the last, 4 years, it is now accepted that about 32% people have gone into abject poverty. 32% people more than the people at that previous level in 2017 or 18 or 19. In the last 3 years, 2019 onwards, the COVID, when the COVID set in, from then about 32% more people have gone below the poverty line. So there is a the side that I'm trying to focus on, that the only policy response to that is that there is more and more allocation of money for, say, the Benazir Income Support Program or the small programs that the provincial governments run. But nobody is really analyzing that when a low middle class family gets into an abject poverty, what kind of social health issues they confront. So it is not only the requirement for, a monthly stipend that comes up. It is much more than that needs to be redefined. And it is happening on a day-to-day basis. The last few years have been as monumental on the societal landscape in terms of economic well-being as the partition was. And I'm saying that with complete sincerity. The partition saw a lot of, very well-off people becoming very poor and a lot of very small people becoming very big. And again, now we are going through another phase of our country where, good, educated, middle and lower middle class families are virtually being forced down the poverty line on a day-to-day basis. And the government is only taking one aspect of this slippage. That is that we have allocated more money to it, and that is all that we needed to do, and all is done. But to me, the more the more important aspect of this change, this big change in their life and the cycle of life, is the social issues, social health issues that they will confront the moment they slip down that line. So maybe these two things that we can, and I will leave it to experts like those on the panel to decide whether they should form one paper or they can form two papers. Maybe, given the times that, government officials and policymakers have for these things, maybe it will be better to have it in one policy paper and have a separate section for that rather than trying to get their focus for two. So this is all that I can say, but let me again thank everybody for a lovely session. Thank you, Ahmad. Over to you.